The good people of this state have allowed our healthcare professionals the ability to treat patients to the best of their ability without having to make dark choices, very real choices that doctors in other countries faced about who lives and who dies. That is a historic and heroic act carried out by all of you. Your efforts to protect your families, protect your communities, protect each other have also given us another tool, and that's time. Time to build up our hospital capacity in terms of beds, ventilators, and healthcare workers. Time to prepare for the kind of surge that could occur any time as a result of a virus from which no one is immune. And capacity we built. In August of 2019, back in a world that had never heard of COVID-19, Illinois had an average of about 26,000 total hospital beds available. As of today, our total bed count in existing hospitals is more than 31,000. Back in August, we had about 2,000 ventilators. That number is now more than 3,200 ventilators. And we're building our healthcare workforce too. There are now 5,000 out of state and former medical professionals who have applied for temporary licenses to join Illinois' fight against COVID-19. We've built up our hospital capacity significantly. But if we let up now, we would have nowhere near the kind of hospital capacity that we would need. The projections are clear. If we lifted the stay-at-home order tomorrow, we would see our deaths per day shoot into the thousands by the end of May, and that would last well into the summer. Our hospitals would be full, and very sick people would have nowhere to go. People who otherwise might have won their fight against COVID would die because we wouldn't be able to help them through. No amount of political pressure would ever make me allow such a scenario for our state, our beloved state of Illinois. So the numbers present us with only one choice. Next week, I intend to sign an extension of our stay-at-home order with some modifications through Saturday, May 30th. To everyone listening, we are in possibly the most difficult part of this journey. I know how badly we all want our normal lives back. Believe me, if I could make that happen right now, I would. But this is the part where we have to dig in, and we have to understand that the sacrifices that we've made as a state to avoid a worst-case scenario are working, and we need to keep going a little while longer to finish the job. On a more optimistic note, my team and I are finalizing the next step principles for safely moving toward reopening in phases. We are making progress building out testing and launching our contact tracing initiative. So that is so important to us that over time we will be able to realize the new normal, and we can be ready. We'll be sharing more on that in the days and weeks ahead. On another optimistic note, May will look somewhat different than March and April. Since implementing our original stay-at-home order, I've listened to Illinoisans across the state and elected officials of both parties and business leaders, and I've continued to consult with doctors and scientists and experts here in Illinois and across the world on how best to keep our people safe. My intention, as always, is to put your health and safety first as we make some practical adjustments based on what we've learned in the first 5 weeks of the stay-at-home order. The new and modified executive order will take effect on May 1st, and I want to lay out some of the changes that we've made for you now. Because we are bending the curve, surgery centers and hospitals will be able to begin scheduling surgeries that had been delayed so that we could maximize statewide capacity for COVID patients. Facilities will need to meet specific criteria, including proper PPE, ensuring enough overall bed and ICU availability, and testing of elective surgery patients to ensure COVID-19 negative status. The Illinois Department of Public Health is issuing exact specifications to healthcare facilities statewide, based on the idea that we need to make sure we have surge capacity. We're allowing some elective procedures to resume for the benefit of patients and our hospital systems, but make no mistake, the first priority for our healthcare system continues to be the health and safety of all Illinois residents. That means preserving bed capacity for COVID patients no matter where they come from. As I've said before, we value all lives equally, and that includes the men and women in our corrections facilities. If we find out that hospitals are refusing to live up to their obligations, the director of the Department of Public Health has the authority to investigate and enforce this policy and will not hesitate to do so. Also, starting on May 1, retail stores that are not currently on the list of essential businesses may take orders online and over the phone and offer pickup and delivery. We've made it more explicit that greenhouses and garden centers may remain open with specified social distancing measures in place. We will begin a phased reopening of some of our state parks under the guidance of the Department of Natural Resources for activities such as hiking and fishing and boating with no more than 2 people. Social distancing must be maintained in all activities. We're also strengthening some of the public health measures in the order to limit the spread of the virus as much as possible. Starting on May 1, any individual over the age of 2 and able to medically tolerate a face covering or mask will be required to wear one when in a public place where they can't maintain a 6-foot social distance. Face coverings work, and we need all Illinoisans to do their part here. For our essential businesses, including manufacturers, we're issuing new requirements on social distancing and new caps on occupancy. Again, all of these things won't take effect until May 1, a week from tomorrow. And they are only minor modifications, what we can do safely, while keeping our stay-at-home restrictions in place as we manage through this next phase. I know that even with these changes, this stay-at-home order leaves many restrictions in place. And in the coming weeks, as we get to the point of working our way down to the other side of the peak, as we move forward, there will be more to do to get people back to work and open up even more. Understand that these are not choices that are made arbitrarily. These changes are what the data says that we can offer the people of Illinois without risking so much viral transmission that our hospitals will again become or potentially become overrun. That said, if we start to see crowds and people violating the order or breaking the rules, I will need to bring back these restrictions. I'm hopeful that we will not need to do that. Folks, this is a battle that you never asked to fight. I know that. I also know that our doctors and our nurses and our healthcare professionals never asked to lead us through a pandemic. Our essential workers never asked to man the front lines of society. Our small businesses never asked to sacrifice their bottom line to an invisible enemy. I see your pain, and I am so very sorry for it. But for every person who wants to go to dinner or hang out with friends in a park or swing open their salon doors, there is a family mourning the death of someone they love. There is a parent, a child, a friend who would give anything to have their greatest strain be the difficulties of staying home and not the unimaginable pain of a life lost too soon. I'm not in the business of comparing suffering. In a pandemic, everyone is allowed to hurt. But we have the opportunity to prevent the pain of loss from touching the lives of thousands. We have the opportunity to follow the leadership of the countless nonprofits and community leaders and families across Illinois who have demonstrated their courage and their empathy and their willingness to help. Illinois has the best people in the world, and I've said all along that I will fight like hell for you. I'm asking you to hold on for just a little while longer to help make sure that we all see through to the other side of this struggle. One day I pray that this virus will be a memory, but the strength that we found together will be something that we carry with us forever.